This meeting to order, meeting number 4 of the House Budget Review Subcommittee on Health and Family Services. As a reminder, remote access is allowed to all meetings of the regular session. Members were provided a Zoom link to access the meeting remotely. The meeting materials were put online earlier and made available for downloading. At this time, we'll have the Secretary call the roll. Members, you will need to indicate whether you're in person or remote from the office.
Representative Bowling.
Remote from my annex office.
Thank you. Representative Fleming. Representative Frazier Gordon. Representative Gibbons Prunty.
Here in person.
Representative Sheldon. Representative Weber. Representative Westrom. Representative Wilner.
Remote from my annex office.
Thank you. Representative Petrie. Representative Reed. Representative Moser. Chair Bentley.
Thank you. We do not have a quorum, right?
No, ma'am.
Okay, we'll dispense with the minutes right now and approve them later if we get a quorum. So, before we begin, for all members participating remotely, please remember to mute your microphones. We do have a full agenda this morning. First, I'd just like to invite Commissioner Morris and Deputy Commissioner Craycraft from the Department of Behavioral Health, Developmental, and Intellectual Disabilities to give us a presentation on the Governor's budget recommendations. You may proceed. Introduce yourselves for the record, and you may proceed.
Good morning. My name is Wendy Morris. I'm the Commissioner for the Department of Behavioral Health, Developmental, and Intellectual Disabilities.
Carrie Banahan, Deputy Secretary, Cabinet for Health and Family Services. And I'm going to step away and let our budget director here with behavioral health. So.
Good morning. I'm Stephanie Craycraft, Deputy Commissioner for the department.
Thank you, Madam Chair and committee members for having us here today. Go to the next slide. Wanted to just start with a brief overview of our department. We are responsible for the administration of state and federally funded mental health, substance use disorder, developmental and intellectual disability programs and services throughout the Commonwealth. We're the federally designated entity by SAMHSA, the Substance Abuse and Mental Health Service Administration, as both the State Mental Health Authority and Substance Abuse Authority. Our mission is to provide leadership and partner with others to prevent disability, build resilience, and facilitate recovery for those we serve. Next slide. The department typically employs over 1,400 staff and an additional 2,000 employees through our contracted facilities. We served more than 6,200 people in our facilities last year alone. This slide shows a distribution of our services. The department provides administration, oversight, technical assistance, and special projects for individuals, programs, and agencies throughout the Commonwealth, and we do have a presence in all 120 counties. On any given day, nearly 800 individuals are served in the department's facilities, which we operate ourselves or under a contract. We have 4 acute care psychiatric hospitals that serve about 350 people a day, 1 forensic hospital in LaGrange, Kentucky, the Kentucky Correctional Psychiatric Center. Historically, we have a census of about 60 in that facility. That's been down significantly due to some staffing challenges that we'll touch on a little later. We have 2 long-term care nursing home facilities that serve approximately 150 people a day, 4 intermediate care facilities for people with intellectual disabilities. We also have 3 specialty clinics, a specialized personal care home, and 3 residential substance use programs. Most of our community-based services are provided primarily through Kentucky's 14 community mental health centers, the CMHCs. They do fantastic work. They're really good partners. And they are a network of nonprofit organizations collectively making up behavioral health public safety net here in Kentucky for individuals requiring mental health, substance use, and/or developmental and intellectual disability services. The centers collectively employ more than 7,500 people and serve more than 150 clients each year. Services include crisis services, diversion services to keep folks in the lowest level of care possible. They serve adults with serious mental illness, children with serious emotional disorders, substance use prevention and treatment, homelessness services, and prevention. As a state authority, we also partner and provide funding to support a number of other community-based partners that are not reflected here. Next slide. We want to take just a minute to focus a little bit on our response to the opioid epidemic. This work is done through the Kentucky Opioid Response Effort, or CORE, as we refer to it. CORE is funded through a series of SAMHSA grants awarded to our department, who serves again as the Behavioral Health Authority. Its mission is to reduce opioid overdose deaths and increase access to high quality, equitable, evidence-based prevention, treatment, and recovery support services across the Commonwealth. CORE also provides leadership across state agencies and community partners to ensure a comprehensive response that maximizes impact and minimizes duplication of effort. We know that overdose rates continue to rise across the nation and here in Kentucky. The causes we know are very complex. A big challenge has been the change in drug supply and the influx of the highly fatal fentanyl in heroin as well as stimulant drugs. Similar to other populations we serve at DBID, there's been a loss of financial security, housing stability, human connection, and purpose, which have threatened the stability of those in recovery. We know that those with mental and physical health challenges, as well as those who've experienced trauma, are even more vulnerable. The framework of CORE reflects our departmental values of providing a comprehensive response, including preventing initiation and misuse through resilience building, integrating screening to intervene early, assertive outreach and engagement to increase crisis service and treatment access, supporting treatment retention through person-centered care, and supporting long-term recovery. This framework provides the groundwork for a recovery-oriented system of care. CORE has funded over 246 programs statewide to implement this response. 112 hospitals have committed to opioid stewardship. Our peer support specialist workforce has grown dramatically. In 2021, over 50,000 Narcan units were distributed and nearly 7,000 suspected overdose reversals were documented. What we know is that we have saved more lives than we have lost. Department initiatives like CORE are grounded in implementing evidence-based practices, and we know that this investment has been effective. Our goal and commitment is to scale up and sustain these programs to reach more Kentuckians impacted by the opioid crisis and underlying behavioral health crisis. And with that, I'm going to turn it over to Stephanie. If you go to the next slide to talk a little more specifically about the budget.
Yes, good morning. This slide shows the department's budget for 2022 by program area. The largest part of that budget, 55%, $273.4 million, is for the operation of the department's facilities. 39%, $191.6 million, provides funding for our community behavioral health programs. There's a breakdown, about 83.7 of that's for mental health programs and close to $108 million for substance use disorder programs. There's 5% that is set aside for community programs for individuals with developmental and intellectual disabilities, and 1% is our general support or administrative costs. Next slide, please, Sarah. So this slide breaks down the current year budget by fund source. Sorry. Let's do quick. 44%, $215.2 million are agency funds. Those are primarily receipts that we get from Medicaid, Medicare, and third-party billers for the operation of our facilities. 30%, $150.1 is general fund, 25%, $125.4 are federal grant funds, and 1% is tobacco settlement. Next slide, please. So this slide shows a comparison of our actual to budgeted expenditures for the department from FY20 through FY24. I won't dwell on it a lot, but just to note a few things. You can see a significant reduction of general fund from fiscal year 20 to fiscal year 21. And that's actually where the community mental health centers support for their Kentucky Employment Retirement System was moved from the department to personnel cabinet in the last budget, but not really a true general fund reduction. Our agency funds are, if you'll note, there's a decrease from expenditures in 2020 through 2021. Part of that is due because of the availability of provider relief funds for the facilities, but the largest part is due to staffing difficulties and vacancies in the facilities this past year. For federal funds, there's a significant increase from 2020 to 2022. That increase is again provider relief funds for the facilities, as well as other funds for our community-based programs that were received under the CARES Act and the American Rescue Plan Act. So you can see those will decrease going out in the outer years. And then our tobacco funds are used for substance use disorder programs for pregnant and parenting women, and also for rural suicide prevention program. That's a collaboration of the department, Kentucky Department of Agriculture, Kentucky Injury and Prevention Research Center, and some university partners to develop community-based programming and education and support for mental health of Kentucky's farmers and farm families. Overall, the department's budget is a little over $534 million for 2023 and $537 million for 2024.
Next slide, Sarah. Thank you. So we want to talk for just a minute about initiatives that were funded in both House Bill 1 and House Bill 285. The department is just really excited about the many initiatives related to behavioral health that were included in both of these bills, and just want to thank you and express our gratitude for that. Behavioral health is, we know, really been highlighted as important during these past couple of years. The first thing is the cost of living adjustments to our employees. As we've already mentioned, as you've heard many times during the interim, staffing shortages have been pervasive, and it's been very difficult to staff our facilities. So this is going to make a big difference. Next is the 90-day crisis support line implementation. As you likely know, in July of this year, 988 will be implemented to replace the National Suicide Prevention Lifeline, or NSPL, making it easier for Kentuckians to seek services when they're having a behavioral health crisis. 10 of the 14 CMHCs are currently NSPL certified call centers, and we anticipate that 13 of the 14 will be fully accredited before 988 goes live. These funds will allow the call centers to respond to the anticipated increase in call volume. When it's a 3-digit number, it's expected we'll get a lot more calls. And it's going to allow calls from Kentuckians to be answered and responded to by Kentuckians, as well as having little to no wait times for response. It's going to provide access to local resources and allow for a faster delivery of clinical care services. Next is the facility COVID testing. This is COVID testing for staff and patients of our facilities. Again, we have up to 800 people in our facilities on any given day and 3,400 staff, which equates to about 5,000 to 6,000 tests a month. These funds are going to allow the department to comply with CMS, CDC, and the Office of the Inspector General. Next is the expansion of TIMS law. TIMS law was passed by the General Assembly in 2017. However, there was no funding provided for its implementation. All of our department's biennial budget requests since that time have contained a request for funding for TIMS law, and we're delighted to have for the first time some funding available for that. In 2020, the department applied for and was awarded a 4-year, $1 million SAMHSA grant to pilot assisted outpatient treatment, or AOT, in Kentucky, which allowed us to pilot TIMS law. It provided for initial implementation in the Central State Hospital region, which is the 7 counties and CommuniCare CMHCs, and that's being expanded this year to Western Kentucky, to our Western State Hospital region, catchment area, which includes River Valley and the Pennyroyal CMHCs. And we believe we'll have enough carry forward money to add life skills and Four Rivers in that same area. Next is rural suicide prevention. This continued tobacco funding for this program, which is a collaboration between the department, our department, the Department of Agriculture, the Kentucky Injury Prevention Program, and Research Center, and as well as several universities. Next is the increased slots for the SCL and Michelle P. waivers. Although this is a Medicaid program, our department does provide the oversight of those programs, which, as you know, are critical supports for individuals with intellectual and other developmental disabilities, allowing them to live in the community and decrease reliance on our facilities. Next is the support of the CMHCs to offset the cost of unfunded liability associated with their participation in CARS, the Kentucky Employee Retirement System. As previously mentioned, the CMH serve over 150,000 individuals every year whose lives are impacted by mental health, substance use, and or intellectual and developmental disabilities. So this is really important, and we thank you. Next, for capital budget, we were pleased to see funding for renovations of our Oakwood ICF Western State Nursing Facility and a substantial maintenance pool. The department's facilities their range in age is from Eastern State Hospital, which was opened in 2013, to Western State Hospital, which was built in 1854. Maintenance pool funding is critical for the department to maintain our state-owned facilities. Again, 4 hospitals, 2 nursing homes, 4 ICFs, 3 ICF homes, 3 clinics, a personal care home, and 2 SUD homes. So we have lots of real estate. Renovation of the Oakwood and Western State nursing facilities in particular will make both of those facilities more efficient and accessible to the people who live there. Next slide.
So this slide includes a list of some of the governor's initiatives that were not funded in House Bill 1. Probably most critical to the department was a request for a current year appropriation for restricted funds for agency funds. The appropriation authority will allow the department to use receipts from the billings of the facilities for operations of the facilities. As the commissioner has mentioned a couple of times, staffing for the facilities has been an extreme struggle over the past 2 years. Direct care staff for our facilities in 2019 there were over 780 full-time and part-time employees. But by July of 2021, that was down to 650. As an example, our largest facility, Western State Hospital, in July of 2020, they were already at a reduced number of direct care staff at 300. By June of 2021, that number had decreased to 246. And in August, 2 months later, the department lost 28 direct care and nursing staff, and they were only able to hire 6 that month. So there's just many other examples of our facilities struggling. And as a result of that, the department has instituted some salary initiatives to try to attract and retain the existing staff that we have. We've done some employee recognition awards. We've added locality pay at the Kentucky Correctional Psychiatric Center. There's been some grade changes and other salary adjustments. So with those salary adjustments, we hope that will lead to increased staff. So we'll have the cost of increased staffing as well as increased costs for the existing staff that benefited from those. So this appropriation authority, again, will allow us to use the funds that we generate from billings to cover those salary initiatives to staff the facilities. Other initiatives included in House Bill 285 was a current year appropriation of tobacco funding for pregnant and parenting women, which of course would assist the departments with its efforts to address the opioid and other substance use disorders. There was additional funding included for Oakwood Generator Project. There is an existing, in the last biennial budget, there was a $1.8 million project set aside to replace the generators, which are 45 years old at the facility. And based on current market rates, that funding will not be sufficient to cover the cost of that project. So again, House Bill 285 included $675,000 to add to the project funding for that. And then again, our Kentucky Correctional Psychiatric Center is on the grounds of Luther Luckett, and it's in a facility that was built in the 1980s. And I think the governor's budget had in the Department of Corrections a project set aside that would allow us to do some security upgrades there, window and roof replacements, and some repairs to HVAC and electrical systems, as well as some other repairs and improvements. Next slide, please.
All right. So our final slide, we just wanted to highlight our priorities for 2022. Our first priority is to increase access to services and supports, and we want to do that by expanding the availability of services and supports, expanding our workforce, increase use of telehealth, and promote public awareness about both behavioral health and intellectual disabilities. Second priority is to improve the quality of care across our service delivery system, doing this by continuing to implement innovative care models, increasing the use of evidence-based practices, supporting the integration of an equity lens across the service delivery system, and improving capacity on data-driven decision-making. And third is to reinforce a resilient, inclusive, and equitable organizational culture by continuing to recruit, retain, and develop a diverse and engaged workforce, advance the implementation of policies and procedures that promote efficiency and effectiveness, embed opportunities for internal collaboration and innovation, and enhance workforce resilience and well-being. Again, over the past couple of years, we've learned just how important resilience is for our workforce. That concludes our presentation. Next slide. So we thank you again for your time, and happy to take any questions.
Thank you for the presentation. Representative Westrom has a question.
Sometimes I wish I didn't have my job, but I certainly wouldn't want to have your job. Can you give me an update on tobacco funds? I do not recall when they end.
Our tobacco funds are typically a continuing appropriation. I'm not exactly sure when tobacco funds overall for the state have a master settlement agreement when that works. But for the department, our funds, it's a continuing appropriation. So typically if programs don't spend those, they're able to carry them forward and continue to offer those programs the following year.
Another question, if you don't mind. Can you describe Tim's Law? I've heard it sitting on this committee, but remind me what that is.
Sure. So Tim's Law, named for Tim Morton, who had chronic and persistent mental illness for a long time. His mother's a huge advocate and part of NAMI. I've known her for many years. Tim's Law is it's a process for an involuntary outpatient commitment. So somebody can be committed, compelled to receive outpatient treatment and services and work with the court. Some call it the black robe effect. Sometimes people will be more compliant if there's a judge and a court involved. And that would be before they really meet the criteria to be involuntarily hospitalized, which of course is difficult for people to be away from their family and away from home and some of those responsibilities. So we've piloted. There have not a lot of people have gone through it yet because it's been pretty new, but we've had the few of those cases have been quite successful. So, and it's called different things. It's called Tim's Law here in Kentucky, but it's nationally there's a lot of programs, and many states have similar programs. Did that answer your question?
Yeah, it does. I have a question about the condition of the state facilities. I've been here for 24 years now, and it's always been a nightmare. How bad is it still? And what are your hopes for full recovery for these facilities?
As far as the physical condition, is that what you mean?
Yes.
Yeah. We have ongoing needs at all of our facilities, and Stephanie and maybe can address it a little better than I can. The two that we're really concerned about right now, one is KCPC. Our Kentucky Correctional Psychiatric Center needs a lot of repairs to make sure that it's secure. And then our Western State Hospital, which was, again, built in 1854, is really, really difficult to maintain and to keep contemporary and updated. But we struggle a lot in our ICFs too. Oakwood and Outwood, the cottages need pretty frequent repairs. Hazelwood's another old one. I guess I could talk about this
Yes.
for a while. Stephanie, do you have anything more?
Yeah, I would
to-
just say we've been pretty fortunate. The department has received replacement facilities for Central ICF, which is now Bingham Gardens, Glasgow Nursing Facility, and Eastern State Hospital, all been replaced. So we've been fortunate there. And again, also recently we've had funding for the updating of the cottages at Oakwood. So really, as the commissioner said, I believe Western State Nursing Facility and Western State Hospital, which was of course built in 1854, and KCPC are our biggest struggles right now. So again, we were thrilled with the maintenance pool funding that was included in the budgets for us.
Another question. Can you give me a guesstimation of the total population that the state is serving at this point in all of those facilities?
Yeah, we have about 800 people on any given day in all of those facilities. That census is down quite a bit from, say, a decade ago. I think we were looking just this morning at census from 2009. There's a lot of factors. One, our census is down in our acute psychiatric hospitals because there is so much more programming for substance use disorder now that people don't have to go to psychiatric hospitals for that type of service. Our census is down in our ICFs because we were under a consent decree with the Department of Justice in the early 2000s, and there was a continued push to get people services in the community, people with intellectual and developmental disabilities. Again, census is down at KCPC right now. It was down because we were not able to keep all the units open due to the maintenance needs, and now it's down because of the critical staffing shortages. We need more beds there. We just have to, we've got lots of initiatives underway, trying some creative things we've never thought about before, to try to increase staffing. And I think the wait list went down for the first time last week. So
Yes.
we're hoping that's a new trend. But yeah, about 800 people a day.
Wow. One more question, just for levity. The building that was built in 1854, has anybody ever reported any ghosts in that building?
I don't know. Have we?
Not officially, but the former facility director was there, did speak of reports of ghosts as well. So
Okay.
it is a beautiful old building. So if you're ever in Hopkinsville and you have a chance to go past it, they considering the age of it and limits on funding in the past for maintenance, they've done an excellent job taking care of it. So,
That's wonderful to know. It's nice to preserve those old buildings. Thank you.
Any questions from our remote folks that are participating? Okay. Sorry, Representative Fraser Gordon? Sure. Oh, okay. I have a few questions. I'll try to do them quickly. I want to give you kudos on the core work. I think that's great. You said there was an increase. When did that increase start? Seeing an increase in the fentanyl coming in.
Well, I think we've seen an uptick in that for quite a while, but the increase in overdoses really, I think that data just started to trend up in the past year.
Yes.
Is that right? Because we've been seeing a decline. But again, as a society, we've had a lot of new stressors over the past couple of years. And it's been a national trend. So we try to stay in touch with, our partners across the nation. And we know we're doing a lot of good work. We just need we want to be able to upscale it and sustain that good work.
Okay.
Do more of it.
Okay, thank you. And then on slide 5, you were talking about the residential. Does that include the contracts with the nonprofits and the Children's Alliance facilities? Does that include them?
So for our residential piece, that's our state-owned facilities.
State-owned.
And the
okay.
contracts that would be included in those would be University of Kentucky for operation of Eastern State Hospital, New Vista for the operation of many of the ICFs and Rest Care. Our community piece, our community partners would be in that community behavioral health portion.
And if you will look at slide, I think it is 3, on that map, you'll see our facilities. Yeah, there they are. All those stars are where our facilities are, and then they're color coded. So the red stars are our acute hospitals and including our forensic hospital. The light blue are our nursing homes. The dark blue stars are the ICFs.
Well, the reason I
And
asked
so
the
on and so
question,
forth.
the reason I asked the
Sure.
question is I'm hearing from some of those folks that have state contracts that are sorely underfunded as well. So that's why I was asking if that was included in the residential, because that's who's talked to me. So apparently, this is just the state-owned facilities, correct?
The ones that are overseen by our department. Yes,
Okay.
ma'am.
Okay. And then let's see. If I can find slide 7. On slide 7, it just caught my attention. The tobacco fund goes way up and then it starts to go down. Is that? I just wondered why that was.
So,
It goes from 900,000 to 2 million to 5 million to 2 million to 1.9. So
House Bill 285, the governor's budget includes a current year appropriation of tobacco funding for pregnant and parenting women. And so that's why it's a single current year appropriation of $2,080,000.
okay, so that's why it's 5.
Yes.
Okay. Thank you for that. And then let's see. On the expansion of Tim's Law on Section 8, you didn't mention. I know it's supposed to go to the west, River Valley. I didn't hear you mention Pennyroyal in Muhlenberg County. Is it included in that as well, or?
Payroll is included. Yes, ma'am.
Okay, I didn't hear you mention it, so I just wanted to ask. And then my final question, on slide 9, we'd love to give more money if it's available, but if not, do you all ever get to do private-public partnerships? I know we did that at Lake Malone State Park for a new dock. There were private-public partnerships. Can you ever do that for some of the financial needs that you have at some of these facilities?
Yeah, we've actually talked about exploring some of those options.
I'm
Yes.
just thinking there might be businesses in a community that might be, supportive and might be willing to help match or something like that. But just a thought on that front. And I have actually been to Oakwood and Hazelwood when I did my physical therapy rotations in school. We went to those facilities. So I've literally. Thank you for your presentation. Any more questions? Representative Westrom has another.
Those were great questions, Madam Chair. I just want to ask you to pass on our deep appreciation to all of the staff and people that work at these facilities. I know that these last 2 years have had to increase the level of stress and decrease the number of employees that are trying to serve these very special populations. We can't meet them, but we couldn't survive without them. Thank you so much, and pass that on, please.
We will, and I will say, in case you don't know, one of our facilities is in Dawson Springs, and we had a lot of staff there who, in addition to everything else, lost their homes. And we were fortunate to be able to provide housing for some of our staff on the campus there. So our facilities, their staff they're like family. So we will certainly pass that on, and we very much appreciate that.
Thank you.
Yes, and echo that from the whole committee. Thank you very much.
Thank you. Thank you.
Next, we have Commissioner Stack and Mr. Tuggle to provide a presentation on the budget recommendations for the Department of Public Health. Just please identify yourselves for the record, and then you may proceed.
We will transition out with them.
Like I said in the last meeting, I'd love to see you guys in person.
Yes, we understand. So hopefully soon.
Welcome. You may proceed.
Thank you. Who has my slides, Carrie?
Sarah.
Thank you. Sarah, next slide, please. So good afternoon. No, it's good morning. Good morning. Maybe it's wishful thinking. So good morning. I'm pleased to be here today to speak about the Department for Public Health's budget. So I have with me Budget Director Mike Tuggle from the Department for Public Health and myself, along with the others from the cabinet behind me. So next slide, please. The Department for Public Health, I realize, has received a lot of attention in recent years for its engagement and activity on COVID-19, but the Department for Public Health does much more than just COVID-19. And in fact, it will return at some future point in time to not doing COVID-19 probably, and mostly doing these other things. So we are here to provide for healthier people and healthier communities. And we really are here through prevention, promotion, and protection to try to improve the health and quality of life for all Kentuckians and ensure all of them have the chance to reach their full human potential. Just some examples of our programs in the prevention bucket: HANDS and First Steps, which are early childhood programs geared towards reducing adverse childhood events and setting people off to a good start at the beginning of life. Immunizations, which are obviously important for a variety of preventable diseases, and newborn screening. And I'll come back to that on my last slide. The Department for Public Health provides all of the 55 mandated newborn screening tests for all approximately 53,000 live births in the state of Kentucky on an annual basis. So that obviously is an incredibly important service, and a service that is not provided anywhere else or by any other lab within the Commonwealth of Kentucky. In terms of protection, we do environmental inspections. Of course, a number of agencies and other parts of government do various inspections. We do milk safety, radon, pools, and a variety of other types of environmental inspections. We have a disaster preparedness area that works on things like the health function when we had the tornadoes go through Western Kentucky, when we have flooding in Eastern Kentucky, and then of course COVID. They've played an enduring role throughout the COVID response. Disease surveillance, again, we talk about COVID a lot, but there's all sorts of other diseases: sexually transmitted infections, tuberculosis, hepatitis, HIV/AIDS, and a variety of other conditions, including the avian flu issue that's arisen. Now, that's not in the human population at this time, but it's our job to keep a close eye on it to make sure it stays that way, or we intervene quickly if that changes. Harm reduction, mobile harm reduction, has to do with addressing the opioid epidemic and helping to mitigate the harms caused by that horrible affliction. And then for promotion, talk about food nutrition services and the Women, Infant, and Children's Program, and other things such as smoking cessation, diabetes prevention, prescription assistance, and any number of other areas where we try to promote good health and help people adopt behaviors that make that possible. Next slide, please. This is a budget slide that's going to show you 2 years of historical data for actual spending, the current fiscal year 22 budgeted spending plan, and then also the upcoming biennium in the governor's proposed budget in fiscal year 23 and 24. The only thing I want to draw your attention to on this: our department is typically about $360 million, give or take. It has expanded substantially because of federal COVID dollars that have come through the department. And you notice that at the bottom in the total lines, we've gone from about $360 million up to $600 million for fiscal year 21 to $770 million approximately for fiscal year 22. And that the largest year would be potentially next year in fiscal year 23. And then it would begin the de-escalation in years forward. And I would imagine we would return to a more traditional type of budget in years ahead. Next slide, please. So this shows all the revenues of the funding sources for the Department for Public Health. Almost 80% of our funds are federal funds. And this is, again, a good way to look at this. Typically, we'd have just under $200 million in federal funds. We have about $600 million. So it's been about a tripling of our federal funding. The other funding sources are generally similar to or consistent with previous experience. Next slide, please. So this slide will show you the expenditures. This is again for the current fiscal year 22. The largest proportion, 53%, goes in grants, loans, and benefits. So this is supporting local health departments and supporting other partners in the work that they do. Personnel costs, of course, like most of our agencies, our people are one of our most valuable assets. And so, of course, there's costs, both directly employed and contracted services included there. And then there's a small sliver at 4% for actual operating costs. That would be for things like technology and information services support, materials to support the laboratory and its work, and other concrete operating expenses. Next slide, please. I have this for the revenue side, and in a minute we'll get to the expenditure side. The single thing I want to show here really is this is for the proposed biennial budget, fiscal year 23 followed by 24. the single biggest point just to draw from this is that the influx of federal COVID relief funds has really altered the proportion and the distribution of these resources. But you see that in 23, we'll expand to what would probably be our largest federal funding for COVID, which would be 72% of our budget, and that would decline to 54% in 24. And we would imagine that would decline further in the next biennial budget when the legislature and the governor deal with that in the future. Next slide, please. This is the expenditure side. And again, this largely reflects what was shown on the pie charts, except that this is now for the forward-looking 2 years, not the current fiscal year. But the proportionality remains relatively consistent as far as what we spend on these various different expenditures of grants, loans, and benefits versus personnel. And then, of course, the small amount for operating expenses. The debt service is a new item, and I'll touch on that on my final slide. That is for a proposed capital spending project for a modernization of our public health lab. Currently, DPH doesn't have debt to service, but should that be approved, we would have the budget would include in the governor's budget the money necessary to maintain that bond funded project. Next slide, please. So these slides are intended to show where the House proposed budget and the governor's budget are perhaps similar or differ a little bit. Let me first say here as I go into this final major section of my presentation, I want to thank both the governor and thank the legislature through its House budget. Both of these budgets provide very important and essential support for public health across the state, both through the State Department for Public Health and also our invaluable local health department partners upon whom we all rely to provide these important services. In these areas, all three of these, both the House and the governor, have recommended funding to address these three essential elements. So first of all, I think we all know our state employees have not had a cost of living increase for far too long. A newbie like me, who's only been here for 2 years, not such a big deal. For all of these other dedicated employees who have been here working so hard and certainly through COVID above and beyond, this is essential and really critical to our ability to recruit and retain a highly talented and committed workforce and to reward them appropriately for the important services they provide. So thank you both to the House and to the governor. Of course, there are differences in the approaches here, and I'll leave that to others to navigate. But we obviously are supportive of recognizing the workforce. The other two items are also very important and predominantly to support the local health department. So in 2020, just before the pandemic hit, in a wonderfully collaborative effort that involved Democrats, Republicans, the House, the Senate, local government, state government, a wonderfully collaborative partnership. And I see Representative Mosier here on my screen. Thank you to Representative Mosier and to Senator Alvarado for their work on this and the others who worked along with us. But we recognized an incredible crisis with the local health departments where more than half of the counties would be bankrupt over the next 2-year period. This is what I thought would be my primary focus when I took this job 2 years ago, and then COVID dealt a curveball to all of us. This funding, though, did not get through. So when they passed House Bill 129 in 2020, the session was interrupted because of COVID, and the funding mechanism didn't get addressed. Thank you to the House and to the governor for putting in place the funding necessary to enact this important transformation and make sure we have a supportable, sustainable public health system for the people of Kentucky. And these are the funds that are necessary, so thank you. And then in 2021, in the regular session, the legislature passed House Bill 8, and that placed certain additional obligations for pension liabilities on contracted workforce that the local health departments and the State Department for Public Health rely upon. This provides the funding that's necessary to implement and make that House Bill 8 doable. And so thank you very much. And this will largely support the local health departments and the work they do. Next slide, please. This is the first area where there is a material or substantive difference between the House and the governor's budget. The governor has recommended just shy of $180 million from the American Rescue Plan, the ARPA state fiscal recovery funds, in order to support ongoing COVID mitigation activities. So COVID will not be with us indefinitely. There will be better days ahead. And at some point we will talk about and even debate other things. But at this point in time, there are still a number of needs to support ongoing testing services, to support distribution of therapeutics, monoclonal antibodies being one of the most obvious examples, ensuring that our PPE supplies that we built up early in the pandemic remain current and unexpired, and supporting a number of other important services. And here the governor has proposed $180 million from the ARPA funds for that purpose. And I commend that to you and hope you'll consider including that as the budget process unfolds further. Additionally, the governor has proposed an additional $1.25 million in added resources for the Pediatric Cancer Research Trust Fund. This is in addition to the funding that is already provided. And again, I would commend this to you. I think we can all appreciate the incredible distress finding out that your child has a cancer diagnosis places on families and the child, him or herself, and how it's important for us to support these initiatives. The next two items are included in both the House and the governor's budget. So the 2.5 million rather of general fund dollars to support the area health education centers would help to support community partners who are working on improving the healthcare workforce pipeline. I know this is a topic that has been widely discussed both by the governor and by the legislature. And so thank you. This is in both budgets at present. And then the final one is not actually money asked of you. It's an appropriation requested of you, and it's in both budgets. This is so that when we provide HANS services, which are compensated for by Medicaid, we have the appropriation necessary to handle the funds, receive them, and to expend them as necessary. So that is a restricted fund item there. Next slide, please. This is the final substantive slide, and I do want to spend just a couple minutes here. Our State Department for Public Health does an incredibly wide array of things, and over 2 years, I've come to have an even deeper and richer appreciation for the valuable services it provides. One of those services is our State Department for Public Health Laboratory. I want to just give you a little bit of insight about what goes on there. So we have a high complexity clinical reference laboratory and select agent facility. And by select agent, I mean we handle the bioterrorism specimens. So if anthrax or white powder shows up in an envelope somewhere, it is that lab that analyzes it. It is a biosafety level 3 facility. There is no other biosafety level 3 facility in the Commonwealth of Kentucky. The building is over 30 years old. The laboratory science and the machines have evolved remarkably. It's almost, but not quite, like going from the Middle Ages into the Star Trek era. These machines generate an incredible amount of heat. They require incredibly precise environmental conditions for temperature and humidity. And this physical plant, this building in which the lab operates, cannot maintain those conditions. And it places us in regular peril of failure of machines, loss of necessary accreditation in order to provide these services for which there is no in-state backup. Some of the other problems in the building, some of the initial equipment in the building, the autoclaves, which sterilize equipment, the water purifiers, the chillers, the big refrigerators that store important chemicals and other materials, are all original install, end of life, and break down on a recurring basis. There's also extensive deferred maintenance with recurrent water leaks from the roof, which run the risk of dripping onto multi-million-dollar analyzers, causing them obviously to get upset and irritable and not function properly, and a potential economic loss to the Commonwealth. There are a number of other issues, but the services we provide, I've already mentioned 53,000 live births about every year for newborn screening. There is no other lab in the state that provides that service. Every newborn has specimens sent there. If we didn't have that lab, we would have to send it at a substantial added expense to an out-of-state lab and pay another vendor to do it. Same thing for the biosafety level 3 lab. Animal necropsy lab, we do the rabies testing, and you have to study the brain of a deceased animal. Murray State does a little bit of it, but we do the bulk of it, and there's not really other options. We also do a wide variety of subspecialty bacterial, viral, fungal culture and genetic subtyping studies that the hospitals and other specialty labs rely upon us to perform. We have a long list of environmental and food safety testing services that are required by federal or state law or regulation. again, we are statutorily directed to do these, and that building is where we do them. I'll wrap up here just by saying that should we lose some of that capacity, there would be an immediate critical need to turn around and get out-of-state contracted services to provide these, because there is no other lab like this lab in the state. The building direly needs to be updated and these issues addressed. We did a feasibility study that we got a vendor for late last summer. We expedited that through the fall. We got the study report in December, and this got in time for the budget materials. It may not have been known or available to the House when they worked on their version of the budget. I would just urge and commend you to please consider including this. It would be a 5-year project, which means in all intents and purposes, it would be 6 years before someone has it. I would love to watch a future commissioner celebrate the cutting of the ribbon and know that the Commonwealth of Kentucky will move out of a then nearly 40-year-old building that has served its purpose well, but at this point simply cannot continue to support the Commonwealth for these critical services because it needs to be replaced with a more modern facility. Next slide. And now, Madam Chair, I offer myself and Mr. Tuggle up to you for any questions that you may have.
Thank you for your presentation, and thank you for all the hard work over these past 2 years. I know it's been difficult, and I know you came in, you got surprised. You got your curveball, so.
Thank you.
Any members have questions? Representative Western.
Thank you for your testimony. I am wondering how many previous administrations have faced much the same challenges regarding the budget. This goes back a long time, and it's very disconcerting. Can you recall how many administrations have asked for these updates for our laboratory in the last gubernatorial reigns?
Representative Westrom, I think, one, I can't because my duration is 2 years. That maybe others behind me could comment. But I think one of the challenges I would imagine always is the case that we have a large physical plant across the state that supports many agencies, and it's always a difficulty. You have to prioritize and make choices about where we do or don't invest. I would just say there is a lot of deferred maintenance across a wide variety of state buildings, and a real need to make use of this moment in time to invest in some of this critical infrastructure so that the Commonwealth is on a solid footing going forward. But as far as historical perspective, I'm sorry, I don't have that to provide.
I guess it boils down to where the greatest firestorm is in what area of the state. Thank you so much for what you do.
You're welcome. Thank you.
Representative Bentley.
Thank you, Chair Lady. Doctor, for this new 40-year-old building, what is the estimate on providing that? How much money would you probably need?
Yes, sir. So the vendor, there's a feasibility study. I believe we've sent that over to Chairman Petrie just recently. It's $135 million bond funded. So this is not an ask for general funds now. This is bond funded over an extended period of time, which would be appropriate for a project like this. And that would enable us to provide the extra physical space needed to accommodate the machines, to expand into some of the other services we've been unable to do, and to correct all of these environmental deficiencies, which are like I said, very current perils.
Yeah, that's very important to the state to keep that up. After teaching 31 years in the university and seeing how many times we've had to update, 40 years is too long. We need to put some more money into that. Thank you, Doctor, and thank you, Chair Lady.
You're welcome. Thank you.
Anybody else have questions in the room? Anybody remote have questions? Seeing none, we appreciate your being here today remotely and giving your presentation, and look forward to seeing you again in the future.
Thank you, Madam Chair. Have a wonderful afternoon.
Thank you. You too. Now that we have a quorum, can we approve the minutes? Motion by Representative Westrom, second by Representative Fraser Gordon. All in favor?
Aye.
Aye. Opposed? Okay, the minutes are approved. Okay, now we move on to our next presentation.
Good morning.
Yes. Introduce yourselves for the record, and you may proceed.
Okay, I'm Melissa Goins, the Director for the Family Resource and Youth Services Center program here at the Covenant for Health and Family Services.
I'm Linda Hardy. I'm Executive Advisor for Serve Kentucky.
Okay, and so thank you for having us today to talk about our department. So our department is divided into two divisions. Sarah, you can go to the next slide. The Division for Family Resource and Youth Services Centers, and also Serve Kentucky, which is our AmeriCorps programs. And so one thing I just want to note on that slide that has the amount for Frisk is that Frisk also receives funding that's allocated to the Department of Education in the amount of $48.8 million. So I may remind you of that as we go through this presentation so that you get a piece of the whole picture. And the way that our funding is divided illustrates the collaboration and the whole child approach that Frisk embodies when it comes to removing barriers to learning for children. Next slide. So in the governor's recommended budget, there is an increase for Family Resource and Youth Services Centers. And, any increase that is received is primarily going to be used for increasing the amount that schools received in operation of their Frisk. Next slide. And this pie chart would look differently if the additional funds from education were included. So if that additional almost $50 million was included, it would actually drive the personnel and operating costs down. So around 97% of the funds received by our department does go out to schools and communities. Next slide. So just a bit about Family Resource and Youth Services Centers. We do have Frisks in our 168 of our school districts. We have 874 centers serving over 1,200 schools. So we do have centers that serve more than one school. Very few serve 3 schools. And then our schools receive between $33,000 and $83,000 to operate a center. And those funds are based on the free lunch eligibility count in those schools. And, we do have schools that where their allocation does not cover the full cost of their Frisk. And we do work with those districts as we can. We have some schools that are able to add additional funds to keep their center open for the 240-day requirement. And if not, then we do what we can to work with those districts to keep centers open for as long as possible. Next slide. So a few highlights I wanted to share, and these are all regarding the 2020-2021 school year. Our local Frisk reported receiving over $17 million in cash and in-kind donations from their community. So that's times, goods, services. And this does not include, because it is for last school year, this does not include the donations received for the recent tornado response in Western Kentucky. Our Family Resource and Youth Services Center coordinator were out in our communities, working alongside our emergency professionals and other school leaders, knocking on doors, checking on their families, receiving, coordinating, allocating donations. And this is something that we're going to continue to do for as long as is needed in that part of the state. Our Frisk also coordinated almost 300,000 volunteer hours during this past school year. And then our home visits, in a given year, we do around 20,000 home visits, and that's in a typical year. So in the 2020-2021 school year, we did almost 4 times as many home visits. And this was important because a lot of our students, if not all of them, were learning virtually for all or part of that time. And we know based on our impact reports that this was just a critical service for a lot of our families. And then the last bullet there refers to our Frisk impact report. So our Family Resource and Youth Services Center coordinators actually track and send in impact reports related related to some of their services. And a lot of that is focused in the kind of the tier 2 level, small group programs, students that have been identified using the early warning tool, persistence to graduation tool, or other data. They target services for those students. You have in your packet a one-pager that has some highlights from the 2021 report. It has a QR code. And so I encourage you to take a look at that. It's organized by subject matter. So if you're interested in things that are strictly academic or attendance or grandparent support, social emotional learning, you can find a report that speaks to that. And then we also have reports that are organized by a location. So if you're looking for something in your district, we can find one for you as well if it's not on the page that you received. Next slide. So this graph just shows the adaptation of services during the pandemic. And I've already spoke to the home visits. That's the blue line. You can see the increase there. But I wanted to also illustrate our telephone, email, text. Frisk does support groups for parents and grandparents, and we transitioned those to virtual support groups. And we found that our parent support groups, actually the participation increased during the pandemic when we went virtual. But that did not remain true for our grandparent support groups. And so, due to a portion of those 85,000 home visits, we were able to connect with relatives or grandparents that are caring for their grandchildren, get them more comfortable with things like Zoom or Google Meets or Facebook, and hold our support groups. And we actually saw our grandparent support group participation increase after that initial dip down. But our Frisk have just done a phenomenal job in adapting the way that they deliver services. We go where families are, and if they're home or out in their community, then that's where we will go. Next slide. So this is an example of one of our impact reports. This was a program that was developed to fight against summer slide. And so not only did overwhelming majority of the kids that participated in this program increase in their attendance and in their graduation score, but they also increased their math and reading score as well. So I just wanted to highlight, we're really, really proud of these reports. And I just wanted to highlight our work in this area. Our Family Resource Youth Services Centers have done a great job in thinking more about outcomes and making sure to share these outcomes with their school board, with their site-based council, with their advisory councils, with their administrators, with their legislators. And so I just wanted to make sure I highlighted those. Next slide. And I believe this is my last slide. So this slide gives a historical perspective on three things. So the blue line is our free lunch count. So you can see we had a steady increase from about fiscal year 8 up until about 16. And then we've kind of leveled off and dipped down a bit in FY22. The orange line is the Frisk per student amount. So the way that Frisk funds get to schools is that we take our overall allocation, divide that by the free lunch numbers, and we get a per student amount. And then funds are allocated to schools based on their free lunch count. So for example, in FY22, if you had 180 students in your school that were free lunch eligible, you would get $183.86 per student, which would get you to a little over $33,000 for running that center for the entire year. And then the boxes indicate the number of centers. So we held pretty steady for years. We lost a couple of centers due to school closings and consolidations. Those were basically the only reason we've ever closed a center is because the schools shifted. And you can see that really in the last several years, from FY8 all the way to 22, we've opened 58 new centers. Our per student amount has increased somewhat from 170 to 183, which meant more dollars went to those individual schools. But our centers have expanded, and those 58 centers cover around 50,000 kids. So those were 50,000 kids in our state that were in schools that were eligible for Family Resource Centers. So eligibility is 20% free lunch. So those schools, they were in eligible schools, but did not have those services. Now those students, those 50,000 students do have access to a Family Resource or Youth Services Center. And that's how we get to 874 centers. Any increase that we receive through the budget, we will be using to focus on that per student amount, because you can see we're a ways off from getting to where we were back in fiscal year 8 when we were sitting around $210 per student. Next slide.
Okay, and on for Serve Kentucky. Serve Kentucky is, of course, the State Service Commission for AmeriCorps in Kentucky. The State Service Commission is what's required by the federal agency in order for Kentucky to receive AmeriCorps funding. And the budget that we have, the AmeriCorps program brings in $10.3 million in federal funds. That is cash from the Fed that goes out to local communities for the 25 current AmeriCorps programs that we have. In addition to the money that comes from the federal government for the participants of the programs, which we call members, there's $4.6 million that they will receive for completing their service in the AmeriCorps program. And that's $4.6 million that they are available to them to use for their continuing education. In addition to that, as you are aware, most federal grants require match. In AmeriCorps' case, the match is actually provided by those programs that want to participate. It's been a more than doubled, 138% increase in the size and number of the programs since 2015, when there were just 12 programs in Kentucky. The programs that we have, the participants, they are going to be not-for-profit agencies or local school systems, higher education. They are the ones that propose the programs and manage those, and they engage their citizens, and it's for the purposes of addressing and solving their own local problems. The program focus in Kentucky, predominantly, it is education-based. They are about tutoring and mentoring at-risk youth, and just basically doing whatever they can within their local communities to make their students successful. We also have some programs that focus on drug abuse prevention and opioid, particularly Unite, which is in the southeastern portion of the state. They also have programs that address homelessness or address disaster preparedness and getting the citizens ready for a potential disaster. Not only do the members participate in service, which if you valued what the members provide in service, that would be over $20 million if they were to be paid a standard wage. But they also leverage those same members leverage volunteerism in their community, and that's getting the citizens involved in. And that's estimated to be an additional $1 million in value from that volunteerism service. Next slide, please. Now, this is our map of programs in Kentucky, and just to talk a little bit about what you're seeing here on this map. The bottom portion of the page, or those symbols or icons, they represent the different programs that we have. So for each of those programs, and these are the programs with members, for every county where there are members serving, the icons for that program appear in that county. So, for example, just looking at Grant County, that has with the graduation cap, that is Kentucky College Coaches, which is a program operated out of Northern Kentucky University as its fiscal agent. And they do whatever they can to help kids be successful in getting into college, making it through their first college experiences, but including just helping kids be sure and sign up for the FAFSA. Again, looking at any of the counties, you can see what programs are there. It tends to be centered in a lot in Eastern Kentucky and around the cities, which is probably most representative of where our first programs, our first AmeriCorps programs originated. And then also there were a lot that were associated with Southeast because they focus a lot on the poverty within Appalachian counties and programs that are very specific to the southeastern counties. Next slide. And that's it if you have questions for us.
Thank you very much for your presentation. I think I've been abandoned in the room. Are any questions from those serving, joining us remotely? Okay, I have a few or comments. I just want to, I can't say enough about the good work that Friskies do. I saw it firsthand, additionally in Hopkins and Muhlenberg counties with the tornadoes, and just appreciate all the work that's being done through the Friskies. Let me see. I'll go back to my slides here. On slide 5, you say there you have Friskies in 168 school districts. How many school districts are there in Kentucky total? Do you know?
I believe there's, I don't know for sure. I believe it's 172, 173, something like that.
So you're almost completely saturated. I mean, you've almost in every district.
That's correct. And the districts that don't have family resource or youth services centers are districts that do not have schools that meet the 20% free lunch threshold.
Gotcha. Okay. And then, let's see. Trying to remember what my question was when I was on this slide. You had mentioned a one-pager with a QR code. Staff did not have that. We do not have that in our possession. If you could send that to staff where they could get it out to us, we would appreciate that.
Absolutely.
And then, let's see. I just want to make a comment on when you were talking about the increase in uptick for parents doing virtual during the COVID and decrease with grandparents. Grandparents probably don't have the technology skills, but I know that I used to do home health physical therapy, and I know going in the home, you know, having that connection with parents, especially if you have parents of kids with disabilities, it's difficult to get them together or get them out. So you're always contact with the families, and in this way, you can be creative moving forward, and you use what you've learned. That could be a positive that came out of COVID to have those greater connections with families. And then I just the impact reports, the math increase in reading, and the scores, just kudos on that. The increase is going to be evident, hopefully, in the future with the success of the kids. And then my final question on slide 11, how do you decide with this, I know that's Serve Kentucky. How do you decide when you go into a county? How's that decision made? Because I know not all counties have an icon.
So actually, these are the AmeriCorps programs are based from proposals from groups or organizations that want to sponsor a program. So it is completely up to those groups how many counties or that they would be successful in. So we are. It's not that we are that we decide which counties that we would operate in. It's awarding a program to an organization that will be the determining factor. We have an RF. It's similar to an RFP process where we review the programs and their plans, and we help and support them at the state level.
Okay. The reason I ask is I see college coaches. I represent the 15th district, and I see icons in Hopkins and Muhlenberg, and with the new redistricting, I'm now going to represent Butler, and there was nothing there. So that's why I was asking the question. So,
right.
How if Butler County, would there need to be a group in Butler that would request that, or how does that work?
It can. Programs, and of course, this represents where the members are serving. So there might be members in the county, even though there's not an official office. For example, A Team is centered in Barron County, and they have engaged a lot of the schools here out to the far west. So, for example, there's a Frisk program who could potentially put a member into your county through that program, or through A Team, or through some of the other programs that expand beyond just a single county.
Okay. Okay, thank you for that. And thank you for your presentations. And again, thank you for all the good work that y'all do.
Thank you.
Mm-hmm. And is this last? Yeah. Again, last but not least, an update on social workers, a staffing report. Commissioner, if you could come to the table and introduce yourself for the record and proceed. Commissioner, y'all introduce yourselves for the record and proceed, please. Thank you for being here.
Thank you, Madam Chair. I'm Marta Miranda Straub. I'm the Commissioner for the Department of Community-Based Service. And this is Lisa Dennis, the Deputy Commissioner and previous Chief of Staff for DCVS. We are extremely grateful for the opportunity to present to you on our staffing challenges. We are heartened and energized by the alignment between the governor's budget and the House budget to recognize the need of staff to be able to carry our mission and our mandate to help vulnerable children, families, and adults. They play a crucial role in providing safety and creating permanency as well as self-sufficiency. So we can now provide quality services, timely services to the Commonwealth without the appropriate staff to do the work. We are the largest agency within the Cabinet for Health and Families. We have a presence in all 120 counties. You have asked for a historical data document, which we sent to you. That's hopefully you have a chance to review it, and we can answer questions regarding that. As you would see, we really fell off the cliff here between 20 and 21. Like many other folks, we're struggling with staffing. However, without staff, we cannot do the mandate that we have. We have the lowest staffing that we've had in our agency in 10 years. We have taken some measures such as really do salary adjustments for entry-level positions. We have created videos and PR campaigns for recruitment with workers with lived experience to do the recruiting. And we have created an interim process with the help of HR to be able to hire staff while they are on the roster and be able to take on cases while HR goes through the paper process, so that hopefully caseloads can go back to being more reduced and we can go ahead and include folks. So we are available for any questions that you have about our staffing issues.
Okay. If you could go into further depth on the validity of the data, and then the quarterly report. I know Chair Petrie is waiting on the data for the budget. So if you could report on that. Let's see, the next reporting period is January 1st to March 31st, and the due date is suggested of April 15th. He needs those in a timely fashion. So if you could just further elaborate on the validity of the data, that would be much appreciated.
So that data has not been received? Is that what you're saying, Madam Chair?
Yes, Chair Petrie is waiting on it.
Okay.
To complete.
My assumption was that was sent to you prior to the document that you all asked for. You asked for a 10-year data spreadsheet, which we sent to you all. Is there more specifics that you need than the historical document that we sent?
We do have a document, but we need the next one in a timely fashion. Does that make sense? Need the next report in a timely fashion? It was a month and a half late, and that's causing problems with the budget process.
Sure.
And we do apologize for any confusion that may have occurred with that. We do provide a legislative caseload report, and that is done quarterly. So I think maybe there was some confusion whether it's the quarterly caseload report that's required, or if there's additional documentation needed. But we'll be definitely ensure that comes over in a timely manner, both the legislative caseload report and our historical data going forward.
Can you just, if you don't care, because I was I was a little bit trying to get myself organized here. Can you explain the chart a little more now that I have it in front of me? I was looking for a slide PowerPoint that didn't exist, and it was just the charts. Okay, if you don't care to go over those figures again, I appreciate it.
We felt that we were here to answer questions about the document that you asked for, which is what we send, the historical data from 2010, not to make a presentation on staffing.
No, that's fine. That's fine. I was the one that was confused. So
sure. Sure.
If you could just explain the table that you sent over a little bit more, so when I can focus on it.
Right. Deputy Commissioner Dennis will do that, and we apologize for any confusion. We hope that the historical document is what you requested, and we'll go through whatever pieces you need us to go through to help you understand the chart and the data.
So when you're looking at the chart, the first section, the chart looks at the number of social workers and clinician positions that we have within the department. So you can see, each year what those totals look like. And then, like the commissioner shared, we've seen a significant change in the last quarter of 2021 into 2022 with a significant decrease in our staffing. And those are the positions that are on the front line doing the direct services with families. And then at the bottom, you can see the total line across there. The worker ones are our entry level positions, and then worker twos, they have a year or two experience, and then our clinicians are our more tenured and experienced staff. So you can see the staffing numbers of each of those categories and how they've changed over the years and the total. And then in the next section, you see the other social work positions. These are our social service specialists and our family services office supervisors, those that are providing supervision, providing supervision to our frontline staff and support through that specialist roles in different ways. And then the final column, the chart, you see the total positions for each year. And then at the very bottom, we have another subsection of that. And you see in the green, our caseload, CPS and APS caseload carrying physicians. These are the workers that are, again, our frontline staff who, from the total above, that are in the social service clinicians, workers and clinician positions that are carrying cases, that are working with families and providing direct services. And then again, you see the total caseload carrying positions, and then the difference between our caseload carrying and our total number of social work positions is our non-caseload carrying positions, and that's the next line at 261 for 2022, and then you see our vacancies at the bottom.
Okay. And I'm going to show my ignorance here, but can you just give me the acronym for CPS and APS?
I'm sorry, Child Protective Services and Adult Protective Services.
Okay, that makes sense. Yeah, I should have already known that, but anyway, thank you.
Sorry, we talk in acronyms a lot. Sorry.
Well, there are acronyms everywhere in every world, and they're all different. So
yes,
I appreciate your indulgence.
We are the worst at it, Madam Chair.
Okay. Mr. Chairman has just returned. Do you have any questions for the commissioner?
Yeah, I'm sorry. Yes, Chair Lady. On the, let's see. Yes, on the social workers there, when is the next time you will report this report that you have here, say end of FFY June? When would the next one be?
I believe we heard today that you want to see this on a quarterly basis, and we'll make sure you have that mid-April.
Okay. Tax day, April 15th would be a good day. right? Hello?
Yeah, I'm very sorry, but I'm not able to hear what you're asking of us.
I said tax day is April 15th. That'd be a good day.
Yes.
We
we'll
can
have
all
it before-
remember that, right?
Yes,
Yes.
thank you. We will have it to you before that.
Thank you very much.
You're welcome.
Thank you, ladies.
Thank
Appreciate
you,
it.
Chair Lady.
Thank you for the opportunity.
Mhm.
Have a great afternoon.
Thank you.
So moved. The meeting's adjourned.